I like that you said spine because it's a chiropractic office. But let's go north of that. Let's go north. There we go. Yeah. So the brain. You see, God put an amazing healing power in your brain and your spinal cord. So your brain has to send messages down your spinal cord and out a nerve in order for everything to heal and function properly. So if your brain is communicating at 100% with your body, and your body's communicating 100% back, you're going to have true health. And each one of you has the greatest doctor in the world inside of you. So if I were to come in here to Kenneth and put a little cut on his arm, right, that cut would bleed, it would scab, and in 3 weeks, what would happen? It would heal. So his body is the healer. I'm not the healer in the office. No doctor can heal you. Your body's the healer. My job is to make sure that there's no interference on your ability to heal and function. Is everybody with me there? So if I cut one of these nerves, if you cut the nerve to the heart, does your heart live or die? It dies because it gets no more life, no more power. It would be like going straight to 0% over here. But if you just put pressure on the nerve, does that heart function at 100% or somewhere less? Somewhere less. And every single day that you leave that damage there to the thyroid, heart, wherever, every day that that damage is there, that organ is getting worse and worse and worse until eventually that thing shuts down. Right? Now, this is the only reason that we actually look at a spine. A lot of people think that chiropractic has something to do with neck pain and back pain, and that couldn't be farther from the truth. Chiropractic as a profession has only ever dealt with making sure that your brain and body are connected at 100% so you can heal the way God intended. Right? Our job is to get you healing the way that your body was designed. So when we look at a nerve system, when we look at a spine, we're looking at structure first. And your spine has to be, well, this guy's broken, okay? But your spine should be perfectly straight from the front like this in order to protect the nerves that come out the side. So if one bone shifts over, what happens to that one nerve right there?
Pinched.
Yeah, it gets damaged. And so wherever that one nerve goes in your body, that part of your body is going to build dysfunction because it's not going to be healing properly anymore, okay? So that one nerve could go into one part of your thyroid. That one nerve could go into breast tissue, a important part of your heart. If you ever had tingling in only one part of your hand, that's because nerves go to specific parts of your body. If you only damage one nerve, you're only going to get disease in that one part of the body. But way more important than, actually, let's go over this because Tekka had talked about it. What's this called?
Scoliosis.
Woo, scoliosis. Right, so scoliosis, the research says it'll shorten your lifespan by up to 14 to 20 years because the brain can't get messages out these nerves anymore and those organs will fail faster. Right, and so medicine's answer is, cortisone shots, bracing, all that kind of stuff, or surgery. Our answer is, well, let's do everything we can to maybe correct that spine back over or hold it in place so it's never continues to go down the degeneration. Way more important than a straight spine, though, are the curves, okay? We need to have a curve in the neck, mid-back, and low back. Actually, let me put this up on x-ray so you can actually see what normal is. This curve right here is called the arc of life, okay? Because if we lose the arc of life, that will take about 20 years off our life expectancy because we're not dealing with these nerves anymore. Now we're dealing with the actual spinal cord itself. So the curves are here to protect the spinal cord. And if I were to damage the spinal cord up here, what actually does that affect in your body? Everything below that. And so if you damage the spinal cord here, that actually, I've seen this before, with people have toe numbness. We adjust their neck and their toe numbness goes away and they're like, what did you just do? And it's like, well, we just removed interference and allowed your body to heal again. Right, so if we look up here, a lot of times that could actually be the cause of back issue. It could be the cause of a whole lot of stuff. And so, now let's go north of that just a little bit also. Does everybody remember Christopher Reeves? Mm-hmm. Old school Superman? So he was riding his horse, right, and he fell off and he hit his chin just like this. And what happened was the top two bones in his spine, these top two, they slipped forward just over a centimeter. So we're talking just a little bit. But from that one injury, completely quadriplegic, nothing would move in his body, but he lived 9 more years, okay? But what happened to him? His heart shut down. He had to have a pacemaker put in to send impulses to his heart. They had a machine called an iron lung breathing for him because his lungs shut down. Massage therapist had to push on his stomach to the bathroom in his colostomy bag because his intestines wouldn't work. He actually spent hours and hours on dialysis for his kidneys. He became diabetic because his pancreas shut down. Christopher Reeves didn't fall off a horse and damage an organ. What did he damage?
His neck.
Yeah, he damaged his neck, and the brain couldn't get healing signals anymore and function, so his organs shut down. And so when we look at x-rays, and when we look at your x-rays, okay, we're looking at direct relation into how the organs are actually working. And you can just look through the spine. Okay, if your damage is here, you're going to have issues in those organs, whether you feel it or not, whether your blood work is normal or not. I actually had a guy sit here not too long ago. He's a great patient in the office. He was sitting here, and he was like, I'm the guy that you talk about. He had 4 heart attacks, and he was perfectly healthy before each one. His doctors gave him clean bill of health, clean blood work. Oh, you're totally good. I don't want to use his name, but you're totally good. And he had 4 heart attacks. It's like something's not right there. So when we look at an x-ray, this is the jaw. That's the back of the head. So you're looking like this, facing this direction. Is everybody with me there? All right, so nice, perfect curve coming right up here. That's the 45-degree curve. That's the arc of life. And then this bone right here, so that's the atlas. I call it the Superman bone or your airplane. Let's just use airplane, okay? So this is the cockpit, and that's the tail. So your airplane needs to angle up like a plane taking off like this. All right, it needs to angle at 18 degrees. Well, if your airplane is crashing, that's going to compress the brainstem. And if it's up like a rocket ship, that's going to compress the brainstem here. Christopher Reeves, his bone moved, a centimeter. What if your bone moves 5 degrees up, 10 degrees down, whatever? What's that doing to you and your health? Shortening lifespan. It killed him in 9 years. It's going to kill our organs and thus shorten our lifespan. And we don't want that to happen to you. So we measure that bone to the degree. On your x-rays, when we look at them, it's going to have a number /18. So you know exactly where that bone is so that we know where to start correcting first, okay? Now, I'm going to take that x-ray, put it this direction so it's with the poster. This is an example patient. Her name is Amy. So does Amy have a 45-degree curve in her neck?
No.
No. So just knowing that, is her body building health or building disease? Disease. But what if she feels perfect? Is it building health or disease? Yeah, it doesn't matter how you feel. It matters how you're functioning. And then look at her airplane here. Is her airplane up like a nice plane taking off or crashing?
Crashing.
Yes. Now, these are her beautiful earrings. All right, so don't pay attention to them. Don't pay attention to those. So she's got damage right at the brainstem and a loss of curve. Her neck actually measures at 9 degrees, so she's lost 80% of the curve that should be in her neck. Okay? Now, Amy actually came in with just a little bit of neck. I mean, like, it had been neck pain that had been going on for like 10 years or so, so it had been like a long time, but not like, oh gosh, I'm dying. Just like, oh, this is really irritating me. I think it's time to go do something about it. She came in, we did an exam, took some x-rays on her, actually sat down with her and her husband and went through this like, hey, Amy, this is definitely what's causing your neck pain, but it's also leading to other diseases in the body, and we've got to start correcting this thing right away. And so we put her through a corrective process. She was coming here 3 times a week, and it was about 2.5 months into care. I adjusted her over here, and she sat up and was kind of teary-eyed a little bit, but I was just like, Amy, what's going on? And she said, oh, I'm pregnant. And I was like, great, isn't this a good thing? Like, why you? She was just acting a little bit different. And she explained to me that her and her husband had been trying to have a kid for 8 years. They'd spent over $20,000. They were going to the best doctors up at Vanderbilt, all these fertility clinics, all these different medications. They were doing everything they could. And she looked at me and she said, this is the only thing I've changed. Could this have done something? Could this have had an impact? And I just explained to her again, when we adjust you and remove interference, the only thing we're doing is removing interference from the brain's ability to communicate to the body. From there, you're the doctor, you're the healer, and it's really important to understand that, because we don't treat infertility, we don't treat headaches, we don't treat migraines, we don't treat any of that, but people heal in this office from things even sometimes I've never heard of. All right, so I just explained to her again, let's get your power turned on and correct it. So we took care of her through her entire pregnancy, have actually been adjusting her little girl since birth to make sure that they're not ever going to lose function. But this was her follow-up x-ray. Do you want some water? We've got like, yeah. Oh yeah, use the cup there. You should adjust it real quick. Yeah. This is her follow-up x-ray after she had given birth. So this is probably about 12 months after she had started. But you see the difference. So we started to see her neck come back into a better position. Her airplane started to lift up, relieving pressure from her brainstem there. So that just means that there's more function getting to her body. Now, is this perfect? No, and there's a good chance that if you're an adult and you're starting to correct your spine here in your 20s, 30s, 40s, whatever, the chance of getting back to perfect 100% is very, very, very minimal, if even possible at all. That's why probably 30 to 40% of our office is just little kids in here, because they've got an actual potential for full life and healing, okay? But she's, now we just need to maintain that. Now, yeah, so why do I go over this? I go over this story because this is so much bigger than neck pain. It's so much bigger than your back pain and what's going on. It's full body function. Nowhere on her paperwork did she write anything about fertility issues. But if she did, if she came here for fertility, would it have changed any way that we work to correct her spine? No. My job is not to try and treat symptoms for anybody. My job is to restore normal so that your body can heal at a higher level. It's very important to understand that. The moment you get into, I want to treat this symptom, is the moment that you lose the health game. You cannot get into symptom management and symptom treatment because all you're doing is treating the symptom. We've got to focus on getting the body truly healthy, okay? This is actually how this works. These are some x-rays and MRIs. So this was some research done back in the 90s. So x-ray, MRI. This is the spinal cord. So this is of the neck, fixing right here. Everybody with me? This is the spinal cord coming right up to the brainstem, all right? If I were to cut the head off and look straight down, this is actually what I would see. So that's the bone around a nice fat spinal cord. That's amazing. This is beautiful, all right? Your brain is sending trillions of messages to every part of your body, right, all the time through here. Now, if you lose that curve, do this with me actually. Put your hand in a nice 45-degree curve here. Feel your skin in there. It's nice and loose. Well, if you straighten your hand out, what happens to the skin? Tight, right? Well, if you do that to the spinal cord actually stretches about 5 to 7 centimeters. Well, if we've lost the curve, when you look at the spinal cord with an abnormal curve, this is actually what the spinal cord will look like. Who gets sick first? Left or right? Right. Who gets heart disease first? Who gets cancer first? The one not healing. Now, this is crazy because what if this person eats perfectly, exercises every day, loves Jesus and does everything right in life, right? And this person smokes 2 packs a day, drinks whiskey every night, and is pissed off all the time. Who still gets sick first? This person. This is wild. No, this is how you have, like, you know, your family reunion where you have, like, Uncle Joe, who's like 95 years old, does everything wrong and like won't die, and like your 29-year-old marathon runner that dies of a heart attack. It's like, this is it. It's all about healing. Now, does that mean that you should get adjusted and then eat crap? No. So we love teaching people how to eat right because that's a huge component to health. Exercise, huge component to health, right? But we've got to put it all together. We've got to correct your spine and do these things at the same time. Because if that's not corrected here, now we move over to phase 2, and this is where this is worst case scenario that we see here. So this is a good disc. That's a good, healthy white disc. That's a good disc. But what do you see happening with those bottom 3? They're degenerating. That's a big word, though. I actually call that rotting. So medical terminology, this is arthritis, degenerative disc disease. I just call it rotting. And if your spine is rotting, what's happening to the nerves that are exiting the spine? They're rotting. And if the nerves are rotting, what's happening to our organs? They're rotting. And it's just how I think of it, but it's true. So I talk to a lot of people and they're like, oh no, you can't help me. I've got arthritis, I got bad discs, I got whatever. And it's like, no, listen, if your spine is in a good position, your body's not going to degenerate. You're not going to have arthritis in here. But if you lose, when you've got this good curve, the weight of gravity is on these bone joints back here. Okay? Well, if you lose the curve, the weight of gravity now goes directly onto the discs, and discs aren't made for that. And so they begin to shear and wear out and build arthritis over time. It's not a genetic thing, it's a structural thing. And if we can bring that back, we can reverse those conditions or at least stop them in their tracks. The longer that you've been going this direction, the harder it is to go back that direction, okay? And quite frankly, the longer you've been over here, the more costly it is to go back that way also. Now, if that's not corrected, why would somebody not correct these, by the way? Why do you think?
They just don't know.
They didn't know, which means we haven't found them and taught them, which is one of the reasons I'm educating you right now, right? Or, well, I guess didn't know is actually probably the only real one, but I educate people and teach them what to do, and then they still say sometimes like, oh, I just don't feel like dealing with that, or I don't have the time, I don't have the money, so they make up whatever. But I look at this as most people out there are just, oh man, I got a headache. This is the actual cause of it, but let me just take a pill. Let me take a pill. And we've got into this culture of fix it now, fix it now, fix it now immediately, or I'm done. That's not how health works. Spinal correction and maintenance is a lifetime effort to make sure your spine is healthy. What do you think takes a spine and damages it? Let me just kind of pause for a second.
Anything.
Anything.
Oh, I love that. So thank you. Anything. Potentially. Think about your kids. Who has kids in here? How many times do they fall and like do stupid things? So it's skateboards, bike accidents, falls out of a tree, jump over a fence, they catch their toe and land on their back or their neck and they cry for 5 seconds and then they're up and good, right? It's like kids fall constantly, but then you as an adult, we're kids now, texting and our head is down here, computer work, driving, everything in an industrialized first world has the ability or opportunity or whatever to change a spine like that. And so we've got to combat all of that while correcting the spine. That's a lifetime endeavor, okay? Now, if that's not corrected, phase 3, most people in phase 3, quite frankly, are in nursing homes or not with us anymore. We see maybe 2 or 3 of them a year, maybe. But it's like we can better their quality of life, but the chances of getting really healthy again are not going to happen. But so, anyway, let's go one more here. I'm going to have to get some water. This is Ann. Is she healthy or sick?
Sick. Ish.
Sick? Who said that?
Sick-ish.
Why? Why? Sick-ish? Did you say sick-ish?
Well, yeah, her spine isn't 45 degrees for one, and it's upward a little bit, not quite as much as it should be.
She said sick-ish. That's actually the first in like 6 years. That was amazing. Okay, so she's got a 14-degree curve in the upper part of her neck in here, but then right here, you actually can see her spine starting to go the wrong direction. So if you think about straightening that spine and then going the other direction, that's exponential pressure on the spinal cord because the spinal cord has to wrap through there. This is called an S-curve, okay? So up here, good disc still has a little bit of a curve, but right there, her spine goes the wrong direction, so this is where she has arthritis and degeneration and rotting. All right, so you can see that these discs now are closing down. There's big bone spurs developing. These ones are actually starting to fuse together, which means that that process has been going on for probably about 40 years. Ann was 51 when I met her, so when did this problem start in her? Yes, sometime back in her past, which is why we take care of a lot of kids in chiropractic, right? Because we want to fix it when it started back there. But Ann, I want to go over some of her stories. She's one of the community partners that we work with. And she just saw unbelievable change, but kind of in a weird way. So 51 when I met her. I want to go back about 20 years. She lived seemingly and felt great and healthy until she was 30, right? And then she started to get random headaches. And she would just do Advil, Tylenol, whatever. Her headaches turned into full-blown migraines. Who's ever had a migraine in here? Yeah, so these were the worst migraines I personally have ever seen. When she would get a migraine, it would knock her out for like 4 days straight. We're talking no light, no sound. She had these cloths she put over her eyes to try and like keep herself from throwing up. Wouldn't go to work, couldn't really be a mom throughout that time. Like really nasty stuff. Eventually she developed an aura, a light ring in her left eye, and went blind in her left eye because her migraines were so bad. Think about just like, that's not fun. The next thing to go was her thyroid. And then surgeons actually just simply removed the thyroid from what was going on. And then her intestines were next. It was like, every time she'd go to the bathroom, constipation, diarrhea, until every time she'd go to the bathroom, she'd be bleeding. And that went on for years. They diagnosed her with a condition called Crohn's disease. Everybody heard of Crohn's disease? They call it a incurable genetic condition. That's what they call it, just to make you feel like really bad. Like it's incurable, so there's nothing that can be done. It's genetic, so it's not your fault. And here is your what? Yeah, one of the drugs for Crohn's disease was $500 a month. $500 a month out of pocket she was spending just on one medication. Altogether, with everything Ann was spending, $1,600 a month on medicine and medical visits. That's almost $20,000 a year. You know what the number one cause of bankruptcy is? Not taking care of your body. That's it. Yes, our medical system and medical bills are the number one like bankruptcy causer. But really, let's break it down. You decided, and let me just speak in general terms here so you don't like try to punch me, but you decided to not take care of yourself. You decided to put your health on the back burner. Oh, I'll put my kids first. I got to take this vacation. I got to pay for this house. I want a better car. And you did everything out there to not take care of your body. And then you lost your health, went into an emergency situation, and went bankrupt from the bills. That's really, truly what happens. And some people don't like hearing that, but it's exactly what goes on. So she's spending $20,000 a year on sick care that's only getting her sicker. She's one of the community partners we work with, and she was telling me her story, just kind of regurgitating it. And my heart broke for this woman. I just said, Ann, you got to get into my office. And she said, dude, I've been to the best doctors out there. You're a chiropractor. What are you going to do? And I don't take things like that personally. I was just like, Ann, it's okay. You don't know what we do yet. Come on in the office. And so we brought her in, took some x-rays. I sat down with her and was just like, Ann, your spine is rotting and decaying. Your nerve system is rotting and decaying. This is what's causing all your issues. We've got to correct this thing. So we put her through a corrective process. And I want to go through what this looks like if this is something that you need. Every time she'd come in here, she would do these traction units on the wall over here. Yeah, did anybody see people using these when you're in here? So the traction units on the wall, you literally get in there and you're working that spine. So you're stretching the muscles and ligaments here, and you're pumping the discs. And so just with that active traction, you can pump fluid into these discs, which brings nutrients back into the joint and waste out. And so just with active traction and a good corrective chiropractic adjustment, you can stop arthritis in its tracks, and sometimes we can start to see things correct just with that. Well, after the traction units, we would come over here and do the wobble cushions, okay? So these are extremely beautiful, sexy cushions over here, and people look great on them. But that warms the spine up down here. So it's the same thing we're doing with the neck discs and the spine, we're doing with the low back and everything, okay? Once the spine's nice and hot, we can get a really good corrective adjustment over here. But what I recognized, this was probably 6 years ago, if we just adjust you and send you home, what happens to your spine in the next days and weeks to come? Yeah, I mean, it's kind of a way to think about it. It's like, yeah, it's gonna go back. It's whatever. And so what we started doing was implementing the vibration plates and the head weight systems. And so the vibration and head weight we use after an adjustment in order to hold that spine into a better position, so we can start strengthening the posture muscles. And so most of us are in this position here, right? Because this is where we live. So we need to bring the pelvis forward, the chest up, and the head back to get our posture back up. And we've got to work every single one of these things, every adjustment. But we also need everybody doing that at home. So why do you brush your teeth? Or do you brush your teeth, Kenneth? You do. Okay. Why do you brush your teeth?
Clean them and keep them healthy.
Clean them, keep them healthy, and prevention, I would hope, of some kind of so your teeth don't rot out of your face, right? Somebody had to teach you that. Who taught you how to brush your teeth?
Mom and Dad.
Okay, well, nobody's taught you how to take care of your spine yet because you don't see it, and it doesn't give you bad breath when it's out of position. I have to now teach you how to do spinal exercises at home, and you need to do that on a regular basis. Really, I mean, think about it. You spend on average 3 hours on your phone a day with your head down in this position. Well, my goodness, we've got to do regular exercises at home. So Ann's coming in here 3 times a week for 3 months. Right, she comes in, warms the spine up, gets adjusted, holds it. Warms it up, gets adjusted, holds it. Warms it up, gets adjusted, hold it. After 3 months, that's 36 visits, we did a new x-ray. It's really the only way I can know how she's really improving, because I don't judge a lot of improvement on symptoms. I judge it on function. I judge it on how well that brain is communicating. Okay, so we do a lot of re-x-rays. After 36 visits, her x-ray hadn't really changed much at all. Right? So I want to go through this with you because some of you might be shocked by that. 36 times you came in here. It should be perfect, right? Ann has been going downhill for 40 years. Okay? So think about that. Her health, her spine, everything for 40 years. She starts getting adjusted here. Do you think her health just goes like this? No. It takes time, effort, and commitment to bring your body back into a better position, okay? After 3 months, we were actually seeing some decent symptomatic changes, so we brought it down to twice a week and then once a week that year. Altogether, that first year, she used 80 visits in our office. So think about eating right 80 times out of the year. She used 80 visits in her office. This is the coolest thing ever, though. Okay, so I'm going to put her post x-ray up here, but in the second week, she never had another migraine that year. After the second week. She had 2 more headaches, but never another migraine, which means that she could actually function again as a mom. She could get her life back. She could start to work again. This is her post x-ray. At the end of that year, she had her vision back, right? She completely reversed Crohn's disease. She actually brought in, one of those like those big Ziploc bags. She was on 14 medications. She brought in one of those big Ziploc bags and threw all of her medications in our drug freedom bin up here because she was able. I don't take people off medication. Don't hear me wrong. We don't take people off drugs. That's not my job. My job is to get you healing and functioning. And a person who's healing and functioning can't take poisons and expect to get health as a result. And so she was able to get off of every single one of those except her Synthroid. She was still on a. She didn't have a thyroid at all, so she could whatever. But my point is that her body was healing unbelievably after a year. Now, you see how this curve is starting to come back in here, right? Even with 40 years of degeneration, time and commitment, you can still start to see those changes happening there. Now, how long does Anne want to be healthy?
Forever.
So how long should she maintain her spine?
Every day.
Yeah, does it? Well, every day. Yes, I like that. Yeah, no, absolutely. And that should, I hope, make sense. Right, I've been adjusted 11 years now on a very regular basis because I've learned that the brain has to communicate and it's all spine. You've got to take care of the spine and nerve system in order for your body to heal and communicate constantly. And so she's been in here about 5 years now, and she uses us as her primary care doctor. She comes once a week, and she uses us as her primary care doctor. So when something comes up, like life happens and like things happen and pain hurts, it's like all this stuff. So when something comes up, instead of being like, okay, Ann, let's figure out what drug you need. It's like, no, Ann, let's figure this thing out. Maybe you've been eating fast food every day. Maybe you haven't worked out in 3 years. Maybe whatever. And we've got to address those things and start taking care of that. And I've learned a lot recently just on the spiritual side, and we teach a lot of mindset training in here. Well, people, if you've got like unforgiveness, if you have unforgiveness in your heart, you cannot physically heal properly. You've got to release that side in order for physical healing to occur. And so we incorporate all 5 essentials into our care in the office to make sure that people are getting everything that they need, okay? But it's just awesome stuff. Now, Anne was on our table one day. And I'd forgotten that she had a little boy at home. And so I just, this was probably 2 months into care, and I was like, Anne, oh my gosh, I forgot. You have a son at home. We need to get him checked. And she looked at me and she said, why would I get my son checked? And I was like, Anne, come on now. When did your problems start? You're 8, 9, 10, 11 years old, so you need to get your son in here to get him looked at. Well, it turns out that her son's name was Shiloh. He was on 3 medications himself already. He was on 2 inhalers and a drug called Singular. Causes anger and agitation in those that take it. So you're giving an 11-year-old kid a drug that causes anger with trying to handle breathing issues. Well, we brought him in here the next visit. This was his X-ray. 11-year-old Shiloh. Think about this. He's already lost most of the curve of his neck, but look at his airplane. See how it's pushing directly up into his brainstem right in here? There should be good spacing there, but that's pushed directly up in there. It's actually measuring at 4 degrees. But this is what's happening in our culture right now. Our parents are bringing their kids to pediatricians with problems, and the pediatrician, what are they trained in? Medication. And surgeries and vaccines, or whatever the thing is. And so that's what they're trained in. They're not trained in health anymore. They're not trained in looking for the actual cause. But when you look at this, just anatomy and physiology, that vagus nerve, this is your autonomic nerve system, anything that's automatic. So when you look at this vagus nerve right here, that goes directly into the bronchioles. This is controlling respiration. This was leading to asthma issues. And he's got damage right there. This was, we put him through a corrective process also. This was 2 months. 2 months into care, his spine comes right back into a good curve. He gets off of his medications also. And now we actually have a mother and a son that can go and live free from that world and actually go and fulfill their potential. That's what Max Living's about. That's why we even have an office here. Right? It's like we help a lot of people here, and the only thing that keeps me going is seeing unbelievable transformations in our families' lives. This is a family office to make sure that you can go and reach your potential. That's what it's about, okay? But it's like, I love stuff like this. Like, love it, love it, love it. I mean, all of us have a decision to make. You can either come this really wide path over here and go down the road of, okay, I'm just going to take drugs and surgeries and eventually end up where everybody else is, sick, diseased, medications. Or you can take this a little bit thinner road, and we've got to kind of guide you, and there's bumper lanes, because we've got to like, oh, no, don't go that way. But it's like, man, when you go down this Max Living pathway and address all the different concerns for health, life looks differently for your family and generations to come. All right, I'm going to go right through here real quick. I don't have to go over this a lot. Does this look healthy or sick?
Sick.
Yeah. The only reason I'm going through so many of these things, I just want to get your head wrapped around this. We have been brainwashed into thinking that, okay, when I'm sick, I take Dayquil and NyQuil and this. It's like we've got to break through that thing. All right, so this right here, I don't want you to pay attention to that one right now. This right here, pelvis, when you look at your x-rays, you're looking at your back. All right, this is the right side and left side. This person here, their pelvis has dropped and their whole spine has this shift in it, okay? That, now we're dealing with the nerves that come off the side. So these nerves go down the legs. They also go into the prostate, reproductive organs, and colon. Up here, you're going more into the intestines and the kidneys. Up here, it might cause acid reflux issues. Those nerves go right into the stomach. And so when we look at this, that person's building disease every single day, whether they feel it or not. Now, I've been showing you some pretty drastic things, but what if there's only a 4-degree curve? What's that doing to the nerve? It's compressing it, and so those organs are dying. If you only have a loss of if you have a loss of 50% of the curve in the neck, 40% of the curve in the neck, it's still doing the same thing. It's shutting life off. And so wherever your spine is, it's time to start doing something about it and actually correcting it. Too often, I sit with people and go over something like this that's so obvious that something needs to be done, and they look at me and they start giving me every single excuse you could possibly think of why they can't take care of themselves right now and all this. And the only thing I have to say about that is, listen, my job is to educate you, love you, and serve you full of abundance, right? Your job is to take full responsibility of your health and actually make the thing happen. I was 22 when I first went to a chiropractor to actually look at myself. I was a pretty sick kid, but at this point I was, I thought, very healthy, even though I had a lot of issues. I'm not going to go into it a lot. But I was a college soccer player, extremely fit. I thought I had things going on. I looked at my spine for the first time. I had a 4-degree curve in my neck. It was almost perfectly straight. And they showed me a curve I had down there and a compression fracture, probably from a trampoline accident I had in middle school. And I'm telling you, I had been to multiple ER doctors, and nobody could ever figure anything out until finally I went to a chiropractor and they showed me what was happening and started to correct it. And I watched my allergies disappear. I watched my health issues disappear, and I haven't had a medication in 13 years now because it's my body is healing and functioning perfectly. I'll just never go into that path anymore. Each person's health is their own decision, right? It's just, I just educate you and make sure that you can make decisions for yourself, okay? Let me go into this. There's 3 things that we ask our patients as we break off and go into different rooms here. Number 1 is that you've got to be committed. Committed people in this office get amazing results. And people that make excuses over here, their results suffer. And I want you to get amazing, amazing results. So commitment looks like this. If you decide that this is the office for you, make the visits we recommend. Your recommendations are based on what we found on your x-ray. They're not just made up in the air. Like, make the visits. Do your home exercises. Commit to coming to the events that we teach and everything. This is actually every month or every other month we do a big event. This one's specifically on the 6 top chronic diseases that are affecting our kids today. When we look at obesity and ADHD and autism, asthma, diabetes, depression is one of them also. But we're going to go through every different lifestyle choice for families so they can start developing healthy families. Right? It's unbelievable. This is where we see unbelievable life transformation. And so get to those things. Commit to join the office and actually do those things. Okay? The second thing, when would you want to know if there was damage on a nerve going to your spouse's heart? Before the heart attack or after?
Depends on how much you like it.
Dang. You're supposed to
Just
whisper.
being
You're
honest.
supposed to whisper.
Being
Your spouse is sitting next to you. No, seriously. Like stupid question, Dr. Mark. Obviously, unless you want to make a joke about it. No, but like, when would you want to know if there was damage on a nerve going to your kids' kidneys and their kidneys were building disease? You want to know that right away. And so what we decided to do, I've talked to my wife about this a lot. What we decided to do is in the first week of your care, if you decide that this is the office for you, in the first week, we'll do all your family member x-rays, everything at no charge, so that we can see what's going on for them. They don't have to start caring here if they don't want to, but I want to make sure that you know and they know exactly what's going on with their spine and nerve system. This is a family office. We have families in here with 12 kids, 11 kids, 7 kids, 5 kids. You know, it's like, this is a family office, so we make sure that families can afford our care, okay? And actually, that brings me to the next point. Let me just go through this with you. There's 3 things that we do to make care affordable,